822 deaths worldwide, while in Nigeria here we have 1,273 confirmed cases in Nigeria, and also we have 239 discharged patients in Nigeria, while we have 40 deaths in Nigeria. Now welcome Robert Victor to take us through top news in the world of COVID-19.
Thank you for having me on the show today. I'm Robert Victor. President Muhammadu Buhari is set to address the nation today. The president will speak to Nigerians in a nationwide broadcast at 8 p.m. today, according to a statement by a special advisor on media and publicity, Femi Adesina.
Now moving on to Ondo State, Governor Rotimi Akeredolu of Ondo State Monday regretted that the surge in the number of COVID-19 cases in the state was as a result of the porous borders and compromised by security agency. He lamented that the cases rose from 3 last Saturday to 8 on Sunday because our borders are still porous and heavily compromised.
Now moving on to Kaduna State. Kaduna extends lockdown by 30 days. Governor Nasir El-Rufai of Kaduna State has extended the lockdown order in the state by another 30 days. The governor's decision followed a recommendation by the State Standing Committee on COVID-19, which is shared by the Deputy Governor, Dr. Adiza. The extension took effect yesterday. This was contained in a statement signed by Muyiwa Adekeye, Special Advisor to the Governor, Media and Communication.
Now, breaking news: Bola Tinubu and the wives Oluremi test negative for COVID-19. Former governor of Lagos State and All Progressive Congress APC leader Bola Tinubu and his wife Senator Oluremi have tested negative for coronavirus COVID-19. Now, quickly moving on to Kano State, we are in serious problem. Ganduje cries out. Kano State Governor Abdullahi Ganduje has expressed worried over the lack of attention the state is facing from the federal government in its fight against COVID-19 despite the level of vulnerability of the state. The governor was monitored in an interview with the BBC Hausa service on Monday, stating that the state is not getting the needed support of the Presidential Task Force on COVID-19. Now, before we move on, let's quickly join the Nigeria Center for Disease on what they have to say on this.
Of your ideas other than the situation in Kano. So we've decided to take this head on. There's been a lot of conversation about the situation in Kano, but first I'd like to remind everyone during a pandemic, the risk of spread is in those towns where the population density is the highest. We understand, we're all aware of the population density in Kano, so Kano has always been very high on our radar. So the high number of cases that we're now seeing in Kano is really not a surprise. We're very concerned about this. We're very concerned about this, and we're doing everything we can. Now, despite our strong commitment to quickly control the spread of the coronavirus, there's no magic bullet. There's no magic bullet. If anyone has one, I'll be happy to get it. But as much as there's been this conversation, our role is to continue to work very hard. Work very hard on behalf of everyone. Work very hard for the people of Kano and the people of every state in the country. So we remain focused on our targets. We're also working very hard to investigate the causes of the deaths that have been reported. Now, mortality surveillance is not easy. So we're working to do what we call a verbal autopsy retrospectively and prospectively together with the public health team in Kano. That is very diligent work that is going on at the moment, and in a few days or a week we'll be able to produce the initial results. We continue to work in collaboration with the Kano State government and recognize the strong leadership of the state. These are difficult times. People have lost loved ones, families have lost loved ones, and businesses have closed. So we understand the difficulty being faced and the challenge and the anxiety. But we will not stop till they get to the bottom of this. So our philosophy at NCDC has always been to consider the states in Nigeria as our primary clients. No states, the bigger states for the work that we do, always pose specific challenges, and we therefore have to put in extra resources to that. We will continue to work very hard, recognizing that there's no magic bullet to solve this problem. It will take more time, stronger collaboration and support from all of you. Our work is to put our heads down and continue. We will not be distracted by any politics, any insinuations. We will continue supporting the people of Kano and the government of Kano State to get ahead of this. This is a time for collaboration. This is a time for leadership. This is a time for solidarity. It's not a time to point fingers. Our work is cut out for us, but we're not running away. We remain committed to achieve the task that we've set out for ourselves. We recognize it's a marathon, not a sprint, and we are committed to the mandate given to us at the Nigeria Center for Disease Control. Thank you very much.
All right, there are some things you need to know about face masks, and if you don't know how to wear this face masks, please listen.
A mask only works if it's put on, used and removed properly. Just follow these simple steps. Before putting it on, clean your hands. Pinch the wire at the top on the bridge of your nose, hook the elastics around your ears, and make sure that your nose and mouth are well covered with no gaps. Try not to touch the mask. If you do, wash your hands straight away. When taking off your mask, remove it from behind. Don't touch the front of it and throw it away into a closed bin. Don't forget to wash your hands well straight after. Please don't use a face mask unless advised to by a healthcare professional. Never reuse a single-use mask. If your mask gets damp, replace it with a new one.
Alright, welcome back. Still on COVID-19 update. Before we continue, let's quickly join one of Teamside FM COVID-19 team in Ghana over there. Let's hear what he has to say concerning the spread of COVID-19 pandemic in Ghana over there. Amevo Felix is online. Amevo Felix, what is the situation over there?
Good evening, fellow listeners and COVID-19 update team. I am Amevo Felix Do Calvin reporting from Ghana. Apparently, as I speak, 21 more people have recovered from coronavirus infection in Ghana. This brings to 155 the total number of recoveries in the country. This was confirmed by the Ghana Health Service on Sunday, 26 April 2020. All those who have recovered are those who were detected through general surveillance. However, Ghana case count has risen to 1,550 with 11 deaths. Thank you for having me on the show this evening. Once again, my name is Amevo Felix Do Calvin, reporting from Ghana.
All right, Amevo Felix, all the way from Ghana. We love you. Thanks so much for this wonderful update coming from Ghana.
More than 200 Cuban doctors and health workers arrived in South Africa on Monday to help the fight against coronavirus. South Africa has the highest number of coronaviruses on the continent with 4,546 infections, of which 87 have been fatal.
Now, the Nigeria Center for Disease confirms 91 new cases of coronavirus in the country. The Nigeria Center for Disease Control (NCDC) on Sunday confirmed 91 new cases of coronavirus in the country, stating that Nigeria now has a total number of 1,273 confirmed cases. The tweet read 91 new cases of COVID-19 reported, 43 in Lagos, 8 in Sokoto, 6 in Taraba, 5 in Kaduna, 5 in Gombe, 3 in Ondo, 3 in FCT, 3 in Edo, 3 in Oyo, 3 in Rivers, 3 in Bauchi, 2 in Osun, 1 in Akwa Ibom, 1 in Bayelsa, 1 in Ebonyi, and 1 in Kebbi State.
Now moving on to Oyo State, Oyo records 2 deaths, 8 active cases. Governor Seyi Makinde of Oyo State has announced the death of another COVID-19 patient in the state. Governor Seyi Makinde of Oyo State has announced the death of another COVID-19 patient in the state, bringing the number of COVID-19 deaths in the state to 2. Makinde, who stated this in his Twitter handle early Monday morning, said the deceased was one of the 3 people whose COVID-19 test results came back positive on Saturday. And let's join Akintola Oluwaseyi from Oyo State.
Good day, everyone. Thanks so much, the COVID-19 update team and DJ Plans. I'm Akintola Oluwaseyi from Oyo State. 3 new cases of coronavirus has been confirmed in the state. And these 3 new cases are expected to be announced by the NCDC in its Sunday daily reports. With the 3 new cases, Oyo State now has 21 cases of the coronavirus, including 1 death. 1 person has been transferred to Lagos State, while 10 people have been discharged. Also, on Saturday, the Oni of Ife, Oba Adeyeye Enitan, donated 2 local fabricated modular fumigators and drones to the Oyo State government to assist in its efforts to contain the spread of the coronavirus. The governor appreciated the monarch for his kind gesture, while he maintained that the fumigators would assist the state a lot in its bid to contain the spread of the coronavirus. The Oni made it known that the 2 modular fumigators donated are 100% homegrown and can be mounted at the back of any truck. He added that the initiative will also be useful post-COVID-19. Thank you so much.
Thanks so much, Akintola, for that wonderful update.
Now still at NCDC. NCDC announces number of COVID-19 tests conducted in Nigeria. The Nigeria Center for Disease Control (NCDC) has said that 11,426 tests of COVID-19 have been conducted in Nigeria so far. The NCDC said this in a tweet on its official Twitter page on Monday. The tweet read, "The COVID-19 Nigerian Situation Report for 26th Daily COVID-19 Situation Report provide a summary of the epidemiological situation and response activities in Nigeria. The Nigeria has recorded 40 deaths and 239 patients have been discharged. Meanwhile, with the announcement by the Nigeria Center for Disease Control (NCDC) that another 81 cases of COVID-19 have been recorded, Nigeria now has a total of 1,273 confirmed cases of the viral disease in the country. Now moving on to Sudan. Sudan COVID-19 cases rise to 237 in the country. Sudan on Sunday announced that 24 new infections with COVID-19, bringing the total number of the confirmed cases in the country to 237. The death toll reached 21, said Sudan Health Ministry in a statement. The ministry also announced the 1 recovery, bringing the total number of recoveries to 20 in Sudan.
Now moving on to Bayelsa State, Dr. Inodo Akpoku, the chairman Bayelsa COVID-19 Task Force Implementation Committee, says the state has confirmed the first case of COVID-19. Akpoku, who confirmed the development in a telephone interview with the news agency of Nigeria, NAN, on Monday said that there was no cause for worry. He said that the state had prepared well to handle the situation. He said that if the affected woman had been quarantined at one of the isolation centers in Bayelsa. Austin is there in Bayelsa State to give us a report on this.
Thank you, DJ Banson. Thank you, the COVID-19 team. I remain Austin Osa Cyberco reporting from Bayelsa State. Yesterday, 26th of April, the first case of COVID-19 was reported and recorded in Bayelsa State. In response to this, the governor of the state has now gone ahead to declare a total lockdown that will last for 1 week. And this lockdown is to begin from tomorrow. All forms of movement, vehicular movement, and pedestrian movement are restricted. Busy areas around the markets are decongested, and sales around the market have also been restricted to essential commodities.